Everyday Health is sponsored by the Froedtert and Medical College of Wisconsin Health Network, turning what ifs into what is possible.
Epilepsy affects people of all ages. In the United States, 3.4 million people are living with epilepsy. Here to tell us more is Dr. Chad Carlson, a neurologist specializing in epilepsy treatment with the Froedtert and the Medical College of Wisconsin Health Network. Dr. Carlson, thank you for being with us.
Thank you so much for having me.
What is epilepsy?
Before we talk about epilepsy, you really need to first talk about what a seizure is. A seizure is like a short circuit or an overactive area in the brain. If someone has 2 or more seizures, that's what we call epilepsy. So thinking more broadly, epilepsy is a condition or a group of conditions that predispose or make patients more likely to have seizures.
Tell us about the variety of treatment options your team offers.
When people think about treating seizures, the first thing that typically comes to mind are anti-seizure medications. Formerly, we called these anti-epileptic drugs. There are over 20 different anti-seizure medications that we can use to treat epilepsy, but for some patients, that doesn't result in them becoming seizure-free. In that case, we look at other treatment options, including dietary options and surgical options.
Is there a difference in where a person receives epilepsy care?
Absolutely. It's important for patients with epilepsy to seek care at a comprehensive epilepsy center, like the center at Froedtert and the Medical College of Wisconsin. At those centers, you're working with a multidisciplinary team that has access to all of the state-of-the-art imaging and EEG resources, including MEG and functional MRI, that can help to understand their epilepsy and ultimately guide future treatment options.
Dr. Carlson, thank you so much for being here today.
Thank you again for having me.
To find a doctor, visit Froedtert.com/epilepsy.